I see communities throughout the United States where people in communities don't have the opportunity to make healthy choices because they don't have safe places to exercise. They don't have access to nutritional food, and they get targeted by advertising, particularly tobacco companies and soft drink companies. They really target low-income populations, people who've been in minoritized communities. And so they're overwhelmed with marketing, and they don't have the opportunity for the choice. So it's not really a choice to be healthy. They don't have those choices. I argue that, we don't necessarily need to make the healthy choice the easy choice. First of all, we need to make the healthy choice a possible choice. And many people don't have the healthy choice as a possible choice.
In a 2020 report of America's Health Rankings published by the United Health Foundation, Kansas ranks 26th among the 50 states on health outcomes. A team of K-State research and extension professionals is receiving training to help communities improve health outcomes at the local level. On today's Sound Living, Extension's efforts to improve health equity and well-being in Kansas. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Ed Ehlinger, Senior Assistant Surgeon with the National Health Service Corps and a coach with the National Leadership Academy for the Public's Health that's working with K-State Research and Extension, says the communities must work collectively in order to build a more robust and effective approach to health.
And a team applied for a grant from NLAF, it's called, to look at community health workers. And I was assigned to be the coach of that team. So I've been working with the NLAF team here in Kansas for the last year and have been meeting with them monthly and learning about all of the issues going on in Kansas. And I've been just, again, impressed with sort of the grassroots work that's going on here. So when I had an invitation to come down here to speak to the extension program, I took it in a second.
You mentioned grassroots, and that was something that you talked about, was the fact that we need to have this health movement really start at the grassroots level.
Yeah, health is all about relationships. It's not about individuals. You can't be healthy all by yourself. We need others. We need community. And so I talk about health being not person-centered, but community-centered. And that means that you are in relationship, certainly with your family, with your neighbors, your community, broadly defined community, your faith community, your employment community, your neighborhood community. And that's where health is. And that's where we really need to put a lot of our energy. And that's where the power is in changing some of the policies. Certainly in my work as a governmental public health official in Minnesota, I really counted on communities to say, this is what we want to happen in our communities. This is what we want you to do to help us. And if you don't do that, we're going to hold you accountable. And so I loved that relationship of the community sort of leading the work that needs to be done in those communities.
So this really went from not only being at the state level, but really being to individual communities.
Yes, certainly throughout the state, I think every community has their own unique needs, and they need to find some way to get organized from different sectors within the community, because too often we have like here, agriculture all by itself, transportation all by itself, education all by itself. But they all interface with each other. They all interact with each other. They all can leverage the skills and abilities from each of those sectors. And so in communities, we need to figure out how to put them all together. We talk about health in all policies. Transportation has health issues related to it. Education has health issues related to it. Agriculture has health issues related. Economic development has health issues related to it. So if we work collectively, we can actually create a more robust and more effective approach to health.
I think one of the things that is troubling is the fact that we spend so much on health, but we don't necessarily achieve the outcomes that we're hoping to achieve. What are some of the shortcomings, and maybe how can we address those shortcomings?
Right. Just in your question, it raises the issue. Health is different than health care. And we spend a lot, I contend, too much on health care because the medical care system, as good as it is, I'm a physician and I think treating patients is a really nice thing and it's an important thing and an essential thing. But we spend way too much money on it at the expense of a lot of the public health and social service and community services that are there. We know that we spend much more money on medical care than any other country in the world by far. And yet our infant mortality rates, our maternal mortality rates, and our longevity are not at all close to what they are in other high-income countries. And what we call the OECD countries, the Organization of Economic Cooperation and Development, those are all of the rich countries that have gotten together. For all of the countries other than the United States, for every dollar they spend on medical care, they spend $2 on public health and social services. In the United States, for every dollar we spend on medical care, we spend 55 cents on public health and social services. And it's those public health and social services that really make a difference. Because if you look at the determinants of health, only about 10% of our health is determined by medical care. It's an important 10%, but it's only 10%. It's really 40 to 60%, depending on how you count it, that are really the social issues that are in the community that respond well to, all of the human services and social services and economic development and transportation and education that goes on in the broader community.
And you're on the high end of that. Do you think it's really closer to 60%?
Yes. I don't have any data to support that, but just from my experience of working with the fact that people say that, 30% of health is related to behaviors, what you choose to eat and what you choose to take in terms of chemicals and how much exercise you get. People say that's about 30%, but I see communities throughout the United States where people in communities don't have the opportunity to make healthy choices because they don't have safe places to exercise. They don't have access to nutritional food. And they get targeted by advertising, particularly tobacco companies and soft drink companies. They really target low-income populations, people who've been in minoritized communities. And so they're overwhelmed with marketing and they don't have the opportunity for the choice. So it's not really a choice to be healthy. They don't have those choices. I argue that, we don't necessarily need to make the healthy choice the easy choice. First of all, we need to make the healthy choice a possible choice. And many people don't have the healthy choice as a possible choice.
Is there a parallel between what you've done in Minnesota and what we could do in Kansas?
Well, Minnesota is no different than Kansas. We've got people who are tied to the land, people who are in relationship with each other, people who have the same goals and objectives to be as healthy as possible, to be in community and thrive. So the things that are being done in Minnesota that have worked could be transported to Kansas and vice versa. I don't want Minnesota to be the healthiest state in the country. I want every state to be as healthy as possible because it's not a competition. I want every state to blossom. And so the work that we've done at the local level in Minnesota around policy, system, and environmental change strategies, that means getting people together to look at what are the policies that need to change, the systems that need to change, the environments that we need to alter to support health. Those things can be done in Kansas or in Missouri or Oklahoma. They will have a different flavor because you have different cultures, you have different values, you have different opportunities. But the same principles will hold in all of the states. And that's what I think we really need to think about as a country and as a state. How do we advance those policy, system, and environmental change strategies that are appropriate for each local community?
If I'm hearing you right, one of the things that's unique about this is not politically driven. This is community. This is public driven. And that may be an area where Extension could help in forming some of this narrative.
Health shouldn't be political. It shouldn't be partisan politics. It is political because health is political because policies are made through the political process. But it shouldn't be partisan. I think whether you're Republican or Democratic or independent, you want the same things. The approaches you take may be different. And that's why you vote to say, all right, we want clean water, or we want access to healthy food. We want good education. All right, so then what are the policy levers that'll get us there? And that's where you have a community conversation. And that's where Extension can really play a role. At least traditionally, Extension was in all communities throughout the various states. And I can't speak for every state, but I know in Minnesota and Wisconsin, where I grew up, they were all over the place. And they were focusing on a whole variety of issues, certainly agriculture, economic development, but also on culture and education and community development. And those are the avenues that we need to take to actually bring vibrant communities. It's not just about ag and just about food, because that by itself is not going to be the total answer. It's a broad array of things. As I mentioned in my talk yesterday, art is so important to the health of a community. It actually gets at the soul of individuals and say, this is what we really need to help us thrive. And Extension can play that role. They've done it traditionally, and I think they can do it now.
Is that one of the things you're doing then, is kind of giving them some advice or some guidance on how they can form that narrative?
Well, I'm talking to them not so much about giving them advice, because they're a lot smarter than I am in most of these areas, but I'm just saying, how does this fit into a broader picture? How do you frame it so that you can move it forward in your community? How do you frame it so that you can get other people to be engaged in the same conversation? How do you frame it so that people from different political backgrounds don't see it as a partisan issue, but see it as a community development issue? So I'm trying to get people to see that frame so that they can work collectively to improve the conditions in which people can be healthy.
Extension has child development specialists, youth development specialists, adult development and aging specialists. They've got family resource management specialists. So really a lot of areas that do come into play when we're talking about public health.
Certainly all of those areas are very important. And we so much go back quickly to the individual model about, healthcare is all about the individual. Child development is all about that individual. Yeah, that individual is important, but they're in the context of the community. So when we're talking about child development, infant development, family development, I want to do it in the context of the community because it's all about relationships. It's all about community. Health is belonging to a community. And so I want Extension, yes, certainly focus on the things that they do well, but put them in the context of community.
So you may look at how the community wants to deal with child care. You might look at how they want to deal with teenage mental health issues, things like that.
Well, certainly I think the problems that we're having, particularly around child care is a good example, is because we've not taken a community-based approach. We've taken it as a individual approach. All right, how can that mother or father find care for his or her child? As opposed to, what do we as a community want for all of the children in our community? How do we bring resources together to make that happen? How do we hold each other accountable for making it happen? How do we prioritize that relative to other things that need to happen in our community? So I think it is us coming together collectively to make those decisions.
So maybe the first step for Extension then, what would that be as they try to get down to the grassroots level?
I think have a conversation with all of the agents or whatever they're called in the various parts of the state about what are the values that we have? What are the values that we support? What's the world view that we have about our communities and about building health and resilience and a thriving community? So what is that worldview? And then what is the narrative that springs from that? Is the worldview that it's all about the individual, or is it really about the community? Is it all about competition, or is it about collaboration and cooperation? Is it all about small government, or is it about necessary government? Those kinds of worldviews then can translate into a narrative, the stories, the tales that you tell, the examples that you use about how you want to move policy, system, and environmental changes in your community. Start with those extension workers in all of the areas around the state, have them talk about that worldview, and then say, how are we going to move that with the narrative that we're going to have as system-wide approach?
How optimistic are you that we will see these changes within the next, say, 10, 15, 20 years?
We're seeing those changes occur already. And they're incremental changes. So you're not going to see all of a sudden you wake up one day and all of a sudden we've got a transformed worldview. It's ongoing, and it's a messy process. Sometimes it gets better, sometimes it gets worse. As you know, we're in the midst of some political turmoil and partisan policy turmoil that derails some of those conversations. So that's going to slow us down. But once we can, and I do see us talking a lot more about things collectively that then get over some of those partisan divides that'll move us forward. So I'm optimistic that we're going to see some changes. I'm optimistic in particular because I see young people, especially not just babies and toddlers and teenagers, but actually those and college students and university students and young adults saying, it's not working what we're doing now. This is not the kind of world I want to live in. And I'm seeing parents and grandparents saying, this is not the kind of world that we want our kids and grandchildren and great-grandchildren to live in. So what do we need to do differently? I see that conversation starting to happen. And I see that the younger generation has more of a social conscience about what needs to happen. And I'm planning on them taking over the leadership of this and moving that agenda forward. I'm optimistic about that.
That's Ed Ehlinger, Senior Assistant Surgeon with the National Health Service Corps and the coach of the National Leadership Academy for the Public's Health. He was a pre-conference speaker during K-State Research and Extension's annual conference. For more information on health and nutrition programs offered by Extension, contact your local Extension office or visit ksre.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.